now I want to show you how to do a subcuticular closure. And this is the type of closure that you would do for cosmesis. For example, someone has a laceration on their face. You would use a nylon suture, which is like fishing wire. You'd use a very, very fine fishing wire, and you might even use one that has no color to it, a colorless suture, which they do make. But for purposes today, just so that you can see the suture and what it looks like, I'm going to show you how to do a subcuticular closure, how it would look pretty and how to start it and how to end it. So we're going to close this laceration in the artificial skin. What I would like to have you do is, here's the end of the laceration. You're going to start about a ½ inch away. You're going to drill your needle until it comes right out at the crotch of the laceration. Okay? And you're going to leave a tail about 1 inch long, because we're going to tape that down. There are many ways to do what I'm showing you, but for purposes of being first and second year medical students, this is the way that I'd like you to at least learn how to do this. So when we put in our next stitch, we start with our needle right at the crotch of the incision, and we bring it out about 1/8 of an inch. But we have to bring it out on the inside of the cut. You'll see what that means. Okay? And now I put my needle in directly across from where the stitch is on the opposite side. So now I'm going to put my needle right across from that. Again, under the skin, because we don't want the suture to show. Pull it through. My next stitch will go across from where the other stitch came out. So it'll go right there. Same thing. Notice at no time have I even put my fingers in the holes today. Learn to use the needle driver to your advantage. Putting your fingers in the holes restricts the motion of your wrist. So here we go. Again, you can load up your needle. It's legal to touch the needle. My next stitch goes right across where that one came out. And again, I'm just barely underneath the skin. So you can see how nice the skin edges of the skin are coming together. Now the reason that you don't want to use silk to do this is because you'll see at the end why. But you don't want the stitch to show through the skin, otherwise it'll leave a color of the black mark underneath the skin. So if you have the ability to do this with a absorbable stitch like monocryl or a vicryl, you can do it, and just make sure that it's not black or blue. So you can see now I've almost closed the incision. We're coming up to the end. And if you look closely, you can actually see the black stitch under the skin as it sort of snakes its way underneath the skin. We're almost down to the very end point, and I'll show you how to end this. There's a way to do it by tying, but that's a different lesson for a different day. We're almost there. One more stitch. Here it is. So now look, you can see I've closed the skin. You can't see the suture anywhere on top of the skin. This is a subcuticular closure. It'll heal very nicely. And now what we're going to do to the patient to end it is we're going to put our needle into the crotch of the laceration, bring it out about a ½ inch away, just like we did here when we started. We started about a ½ inch away from where the skin was actually lacerated. We started, put my needle in, brought it out at the crotch of the incision, and now we're going to cut it right there. And we're going to put either some skin glue on top of this in the operating room, and then we're going to tape down the edges here. So when the patient comes to see me in the office and gets their stitches taken out, all I have to do, if it's a clear stitch, is just cut it. Just simply cut it. Or if it's a strong stitch and they're coming in and it's been, say, a week or 10 days, that's usually when we take stitches out, is between 7 to 10 days and sometimes 2 weeks. If I can pull this all the way through, I don't know if I'm going to be able to do it here with this fake skin, but sometimes I can literally just pull this suture all the way through. So I'm going to remove the entire stitch and it will have healed, and now the patient doesn't have any suture at all in the wound. So that's the way you do a closure. And some other time I can show you how to tie it or start in the crotch of the laceration and end it with a suture, but the way I just showed you will work for most of the things that you'll want to do. That's it. If you have any questions, please email me, and attend all of the Surgery Club's sessions.